NLN Nursing Entrance Exam Questions. Question 1. Which dose volume gives 312.5 mg from a supply of 125 mg per 1 ml in this nerve signal item? Option A, 5 ml. Option B, 2.5 ml. Option C, 1.25 ml. Option D, 0.4 ml. The correct answer is option. Set up the proportion 125 mg, 1 ml equals 312.5 mg x ml, so x equals 312.5 times 1, divided by 125 equals 2.5 ml. The other volumes reflect errors such as doubling the dose, having the dose, or reversing the proportion. Question 2. During a quick next review of an endocrine message item, which word is closest in meaning to predict in a study guide note? Option A, borrow. Option B, repair. Option C, remember. Option D, a forecast. The correct answer is option. Predict means forecast, so that choice matches the meaning in context. Borrow means take temporarily, not forecast. Repair means fix, not forecast. And remember means recall the past, not forecast. Question 3. After checking the choices in a glucose regulation item, which answer identifies the process moves water across a semi-permeable membrane? Option A, exocytosis. Option B, mitosis. Option C, osmosis. Option D, transcription. The correct answer is option. Osmosis is the diffusion of water through a selectively permeable membrane. Exocytosis moves materials out of a cell, mitosis is cell division, and transcription copies DNA information into RNA. Question 4. If a chart reading STEM gives one clear clue, which statement gives the best main idea of this passage? A patient education sheet used short sentences, headings, and pictures. Option A. Clear formatting helps readers understand health information. Option B. Headings reduce the value of information. Option C. Long paragraphs are best for patient teaching. Option D. Pictures make written instructions unnecessary. The correct answer is option. The sheet is designed to improve readability and comprehension. Headings reduce the value of information, is not supported by the passage. Long paragraphs are best for patient teaching, is not supported by the passage. And pictures make written instructions unnecessary, is not supported by the passage. Question 5. When time is limited on a ratio setup question, which increase is shown from Monday 16 to Wednesday 24 in a simple practice chart? Option A, 8. Option B, 24. Option C, 5. Option D, 40. The correct answer is option. The increase is the final value minus the starting value, 24/16 equals 8. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 6. Given the information in a unit conversion item, which average results from scores of 65, 69, and 73? Option A, 207. Option B, 8. Option C, 69. Option D, 67. The correct answer is option. Add the 3 scores to get 207, then divide by 3 to get 69. The other choices use the sum, the range, only 2 scores, or an added value rather than the mean. Question 7. Suppose a similar percentage item appears on test day. Which word is closest in meaning to relevant in a study guide note? Option A, ancient. Option B, unrelated. Option C, related. Option D, heavy. The correct answer is option. Relevant means related, so that choice matches the meaning in context. Ancient means very old, not related. Unrelated means not connected, not related. And heavy means weighty, not related. Question 8. While working through a timed fraction item set, which answer identifies the tiny air sacs exchange oxygen and carbon dioxide? Option A, alveoli. Option B, nephrons. Option C, villi. Option D, bronchi. The correct answer is option. Alveoli provide thin, moist surfaces where gases diffuse between air and blood. Nephrons filter blood in kidneys, villi absorb nutrients in the intestine, and bronchi carry air toward the lungs. Question 9. Before choosing an answer in a mean score item, which statement gives the best main idea of this passage? A volunteer program grew after former patients shared personal stories at orientation. Option A. Volunteer programs grow without communication. Option B. Orientation should never include stories. Option C. Former patients stopped the program. Option D. Personal stories can motivate people to participate. The correct answer is option. The passage shows participation increased after meaningful stories were shared. Volunteer programs grow without communication is not supported by the passage. Orientation should never include stories is not supported by the passage, and former patients stopped the program is not supported by the passage. Question 10. A student sees this probability set idea on a next review. Which answer identifies the group that does not receive the experimental treatment? Option A. Experimental group. Option B. Conclusion. Option C. Sample. Option D. Control group. The correct answer is option. A control group provides a comparison for the treatment group. Experimental group receives the treatment, conclusion is the final interpretation, and sample is the participants or items studied. Question 11. One test strategy practice problem tests this skill, which for flow rate delivers 1.2 L over 8 hours using a 60 GDT/ml set? Option A. 155 GDT/min. Option B. 150 GDT/min. Option C. 9000 GDT/min. Option D. 2 GDT/min. The correct answer is option. Convert 1.2 L to 1200 ml, then use 1200 times 60 divided by 8 times 60 to get about 150 GDT/min. The other choices come from common errors such as skipping the drop factor, using hours instead of minutes, or rounding before the final step. Question 12. Several choices look tempting in a main idea item. Which word is closest in meaning to sequence in a study guide note? Option A. Order. Option B. Weight. Option C. Texture. Option D. Chaos. The correct answer is option. Sequence means order, so that choice matches the meaning in context. Weight means heaviness, not order. Texture means surface feel, not order, and chaos means disorder, not order. Question 13. For this inference clue nursing entrance question, which answer identifies the chemical messenger released by endocrine glands? Option A. Enzyme. Option B. Platelet. Option C. Antibody. Option D. A hormone. The correct answer is option. Hormones travel through the bloodstream and affect target tissues. Enzyme speeds chemical reactions, platelet helps clotting, and antibody targets antigens. Question 14. In a short author purpose practice STEM, which statement gives the best main idea of this passage? A school added quiet study rooms, and students reported fewer distractions. Option A. Reducing distractions can improve study conditions. Option B. Distractions are always helpful. Option C. Students no longer needed to study. Option D. Quiet rooms increase noise. The correct answer is option. The result directly connects quiet rooms to fewer distractions. Distractions are always helpful is not supported by the passage. Students no longer needed to study is not supported by the passage, and quiet rooms increase noise is not supported by the passage. Question 15. Among the choices in a summary task item, which critical thinking response best fits this situation? A graph rises sharply after a policy change, but no other information is given. Option A. The graph shows a possible association but does not prove causation by itself. Option B. Graphs cannot show patterns. Option C. The policy must be ignored. Option D. A rising graph proves the policy caused everything. The correct answer is option. A time pattern can suggest a relationship, but causation requires stronger evidence. Graphs cannot show patterns, does not follow from the situation. The policy must be ignored, does not follow from the situation. and a rising graph proves the policy caused everything, does not follow from the situation. Question 16. Using the facts in a sentence correction question, which value of x solves 3x plus 12 equals 27? Option A 4, option B 5, option C 6, option D 15. The correct answer is option. Subtract 12 from both sides to get 3x equals 15, then divide by 3 to find x equals 5. The other choices result from stopping after subtraction, adding one too many, or not reversing the operations in the equation. Question 17. Based on the clue in a punctuation review item, which word is closest in meaning to verify in a study guide note? Option A, doubt. Option B, borrow. Option C, hide. Option D, confirm. The correct answer is option. Verify means confirm, so that choice matches the meaning in context. Doubt means question, not confirm. Borrow means take temporarily, not confirm. And hide means conceal, not confirm. Question 18. Consider this high-yield pronoun agreement concept. Which answer identifies the cell division that produces gametes? Option A, mitosis. Option B, translation. Option C, meiosis. Option D, diffusion. The correct answer is option. Meiosis reduces chromosome number and produces sperm or egg cells. Mitosis produces identical body cells, translation builds proteins, and diffusion moves particles down a gradient. Question 19. Near the end of a parallel structure review session, which statement gives the best main idea of this passage? A report says infection rates fell after staff completed a hand hygiene refresher. Option A, training may have improved compliance with hygiene practices. Option B, training increased infection rates. Option C, hand hygiene cannot affect infection. Option D, the refresher removed all risk permanently. The correct answer is option. The sequence suggests training supported better hygiene behavior. Training increased infection rates is not supported by the passage. Hand hygiene cannot affect infection is not supported by the passage, and the refresher removed all risk permanently is not supported by the passage. Question 20. Across similar active voice nursing entrance questions, which increase is shown from Monday 15 to Wednesday 25 in a simple practice chart? Option A, 40. Option B, 25. Option C, 10. Option D, 7. The correct answer is option. The increase is the final value minus the starting value, 25 15 equals 10. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 21. Since only one choice fits the capitalization check clue, which increase is shown from Monday 16 to Wednesday 22 in a simple practice chart? Option A, 6. Option B, 22. Option C, 3. Option D, 38. The correct answer is option. The increase is the final value minus the starting value, 22 16 equals 6. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 22. From the information in a clinical scenario item, which word is closest in meaning to adequate in a nursing entrance reading item? Option A, hostile. Option B, empty. Option C, sufficient. Option D, ancient. The correct answer is option. Adequate means sufficient, so that choice matches the meaning in context. Hostile means unfriendly, not enough. Empty means lacking contents, not enough. And ancient means very old, not enough. Question 23. At a testing desk during a community clinic review, which answer identifies the solution with pH above 7? Option A, acidic. Option B, hypotonic. Option C, basic. Option D, neutral. The correct answer is option. A pH above 7 indicates a basic or alkaline solution. Acidic describes pH below 7, hypotonic describes lower solute concentration, and neutral describes pH 7. Question 24. Inside a student survey science or skills item, Which statement gives the best main idea of this passage? A clinic sends appointment reminders, and missed visits decline. Option A, reminders caused more missed visits. Option B, patients cannot benefit from reminders. Option C, appointments no longer need scheduling. Option D, reminders can help patients remember appointments. The correct answer is option. The decline in missed visits supports the role of reminders. Reminders caused more missed visits is not supported by the passage. Patients cannot benefit from reminders is not supported by the passage, and appointments no longer need scheduling is not supported by the passage. Question 25. Through careful reading of a wellness app STEM, which answer identifies the transfer of heat through direct contact? Option A, convection. Option B, evaporation. Option C, conduction. Option D, irradiation. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Convection moves heat through fluid circulation. Evaporation is liquid changing to gas, and radiation transfers energy by waves.